Hey, it's Dr. Troy here, the Vancouver chiropractor. Today I want to talk about spinal decompression. Particularly I want to talk about low back spinal disc non-surgical decompression treatment for patients with sciatica, bulging discs, herniated discs, sequestered discs that may have leg pain, sciatica, spinal stenosis, spinal degeneration, neuropathy. These are the types of patients that we've seen improve greatly with spinal decompression. We actually have a patient on the table right now, and you can see she wants to take a nap, it looks like, but pretty much we harness the pelvis and we harness the upper back and we decompress the disc. We can actually focus, if we come over here, we can actually focus on which level, L5, L4, L3, L2, L1, which disc level involvement there is. Usually that's going to be determined by looking at an MRI. So now if we want to do an L5, we're actually at L5 on this patient, but we want to do L5 disc treatment. That just depends on which angle the pole is going to come out at. And if we, a lot of people are scared when they have back pain to move or do anything. I got to tell you, firsthand experience, I've been through 2 rounds of serious back pain. The reason I bought one of these machines is because I was driving 60 minutes 3 times a week to get my treatment, and I said, I'm going to buy one of these for myself. And I just happened to let patients borrow it every once in a while. But Lisa's laying on our machine, and we'll just ask her a couple questions. I've got the mic in my hand, so let me bring it to you before you answer, okay? So how's it feel? Is it comfortable? Is it sore? Are you in pain? Or tell people that are interested in this what you're feeling.
It feels really good. It's not uncomfortable at all, actually, and it feels good.
So do you feel like you want to take a nap, or you need a latte, or what?
Yes, all of the above would be great.
Okay, good. So she's actually going through about a 28-minute treatment protocol. There's 18 cycles. We're going to take and we're going to pull. With her, we're pulling about 60 pounds. We usually use about half the body weight. And we start conservative, and then we can work our way up. But one thing people do notice when they get off, it can kind of wake things up. So there's a rehab protocol for help strengthening the muscles. The one bad thing is people come in, they get disc decompression, and you don't need rehab with it. And so if you don't do the rehab with it, now you've pulled the disc apart and gotten it functioning and more fluid in there and healthier. But you got to strengthen what supports that. So in many cases, it's the weakness in the chain, the kinetic chain, the posterior muscles in the spine that weaken. Now it starts compromising the discs, the nerve roots, and that's where really the combination of the decompression and some of the rehab stuff that we do can help. So going back to this, we have a 60-second pull, and then we're going to take a break for 30 seconds. So right now you can see that she's going into, it's relaxing. You're going to get 30 seconds of basically less pull on the disc, and then we're going to go ramp it up here again for another 60 seconds, and it's going to get up to about 60 pounds. So this is what we want to do to the disc. This is actually what's happening to her spine and her disc. So this is what's going on. And this here is feedback from the servo motor. So the motor is communicating 13 times a second with what's happening to the patient. So if Lisa was to, let's see, Lisa, maybe move a little bit. Okay, and relax. So you notice she moved, and you can see the big spike here. So, because ideally what we want to do is this to the disc, so the motor is getting feedback, so it's trying to accomplish this, because sometimes people, when they're in a lot of pain, they have muscle spasm. So this just helps us control the pull so that we can get the desired treatment protocol that's been known to be very successful in these cases. So this is Dr. Troy on lumbar disc decompression. If you're suffering, looking at surgery, you've had surgery, potentially this could be right for you. Free consultation. Call the office. One of our doctors would be happy to take a look at you and let you know if spinal decompression is right for you. 360-260-6903.